I'm Professor Corinna Hawkes. I'm a Distinguished Fellow at the George Institute for Global Health. I'm Vice Chair of the London Child Obesity Taskforce and I'm Director of the Centre for Food Policy at City University London. Work on obesity emerged in London after the Mayor of London, Sadiq Khan, produced a health inequality strategy last year in which he expressed a lot of concern about the high rates of obesity in London. So rates of unhealthy weight in London amongst 10-year-olds, 11-year-olds is the highest in the country, of any region in the country. And also there's a huge range of obesity levels, prevalence levels in London. So that ranges from really very low levels in wealthy areas with high socioeconomic status to very high levels in areas of deprivation. And from a health inequalities perspective, he was very concerned about this particular health issue amongst our children, even amongst the youngest of our children. So he appointed the London Child Obesity Taskforce to try and step change the work that was already going on in London to address this problem. The London Child Obesity Taskforce focuses on children even though overweight and obesity prevalence is even higher among adults. And the first reason for that is because children experience the ill health effects. That means that anything from mental health problems to early onset of type 2 diabetes. The second reason is because if we target children and they adopt healthy habits in childhood, they're more likely to go on and be healthy as adults. So it's a more efficient way of encouraging healthy adults as well as healthier children. And there's another reason for focusing on children, which is more of a kind of a moral reason, which is that children have the right to be protected and nurtured. So a healthy food environment is an environment around people, and it's an environment in which healthy diets, so that means lots and lots of foods which are associated with good health and not many foods which are associated with poor health, are available to people, they're affordable to people, they're acceptable to people, and they're appealing to people. It's important because if the food environment was perfectly healthy around people, then we wouldn't have a problem of overweight and obesity. So if every child in London was born into that perfect environment, we simply wouldn't have a problem. However, once people become accustomed to an unhealthy food environment, then simply changing that environment becomes difficult because you're essentially taking foods away from people that they really want to eat because they become habituated to them. So it's not as simple as just saying, let's create a healthy food environment. You also have to do other things that accompany that around making sure that people have enough resources to buy healthier food, to make sure that people have the care and support that they need in order to be able to encourage them to eat healthier. But when it comes to the actions to actually change the food environment itself, so that means doing things like working with retailers, working with fast food outlets, working with stores, to make those foods more available and appealing through a whole range of methods. But you also have to regulate and you have to engage with business to reduce the unhealthy foods, which is the really, really hard part. We went out and spoke to children and their caregivers and parents around their daily lives. In one of our profiles, the child who's around 4 or 5, her parents work very, very long hours for low income, and they leave the house for their shifts at 6 o'clock in the morning, and someone has to look after her. So they take her to their grandmother, who fortunately lives very close by, but their grandmother is sick and has problems moving around. So what's going to happen? Is the grandmother going to spend hours preparing the healthiest breakfast? Or is she going to give the child the thing that is going to keep them quietest when she has to sort herself out at a very early hour in the morning? Well, it's the latter. It's in front of the TV with a bowl of cereal, sugary cereal. Can the grandmother walk to school and get some exercise? No, because she's sick. So, in other words, what this is telling us is imagining this ideal scenario where people have got lots of time and space and they just need to have the knowledge to prepare a healthy breakfast. That's not what it is. You can be as knowledgeable as you want, but when you've got those kinds of constraints, it becomes very challenging. there's a whole system of causes that influence childhood obesity, and you need to act in all of those different areas if you're going to affect change. But it's not about doing absolutely everything, it's about identifying actions that can have transformative potential across the system. And these are the actions that we've attempted to select in the call to action of the London Child Obesity Taskforce. Those actions cover changes in the environment around changing fast food, for example, because we know that's where young people like to go. They involve making changes in schools because young people spend a lot of their time there. It's also about making sure that people have enough money to buy healthier food and that the training and support is in place. So we make recommendations and a call to action, if you like, across all of these different areas. So the work that we've done in London is very much about trying to find the actions that are right for London's context. However, there are definitely lessons to be learned for elsewhere. And the first is around engaging with children and understanding the realities of children's lives and the lives of their caregivers as a means of identifying what actions are going to work. The second learning is around building on what's already there. So often we see, we've got a new obesity strategy. It's like you're starting from nothing. No, don't start from nothing. Start with the assets that you have in terms of the actions that have already been taken, but also the assets of the people who live in your city. And remembering that, of course, people are the greatest assets that you have. And the third learning is really about saying you need to have action in all of these different areas. And that cities are a good place to test out that combination of actions. So a call to action for me would be cities, get your act together and start showing nations what can be done. And for that reason, at the London Child Obesity Taskforce, we're initiating a process of working together with other cities so that we can actually share learning across cities and provide mutual support to each other.